Well, as promised, the Department of Public Health has released its proposed amendments to its state plan for Medicaid. This comes in the wake of an unexpected inflated Medicaid reimbursement rate at the Guam Regional Medical City. Here's what you need to know.
It won't take effect right away. Public Health Director Jim Gillen says there will be a 30-day public comment period on the proposed changes. The state plan will then be sent to the governor for approval, who will then send it to the Centers for Medicare and Medicaid for their final approval. If it's approved, this means that reimbursement rates for Medicaid will change. Teresita Gumatautau, the program coordinator from Public Health's Medicaid program, explains that the changes will only pay hospital inpatient and outpatient services at the lowest rate of Medicare reimbursement and not to exceed 150% of that rate. Gumatautau says these proposed changes to the plan will mean equal coverage across the board.
Currently, the hospital's Medicare interim rate is what you follow for each hospital. So just that now with the two hospitals, each one has two different Medicare interim rate. So what it is, we're trying to reimburse now providers, the hospital, equitably across and to be cost effective with our funding. So we're revising the state plan to have this two phrase that we're using right now is to pay the lowest of the following for each hospital.
Gumatautau says this change is proposed because the funding for Guam's Medicaid program is already vastly limited, and with the Guam Regional Medical City's recent announcement that CMS approved a 400% increase in their Medicare reimbursement compared to the Guam Memorial Hospital's rate, Public Health emphasizes that they must be proactive in ensuring that they have enough funding to cover all their beneficiaries.
It doesn't affect them and services, it's more of making sure we maximize our funding for the program, because the reason why is that our funding is capped here in Guam, so we just to maximize and not jeopardize the services for our recipients, because there is two hospitals, otherwise we're going to have to send them off island. So it doesn't affect them at all, because if the service is not available here on island, we still can send them off island, either to the Philippines or to California.
According to the plan, Medicaid will pay all Guam outpatient hospital ancillary services, including operating room, laboratory, x-ray, physical, occupational, and inhalation therapy. And if the fee schedule is not covered by Medicare, Medicaid will utilize other programs off-island.
The Department of Public Health and Social Services is inviting the public to view the newly proposed amendments to the state plan and give their feedback via their website at dphss.guam.gov. You can also view the proposed changes at the Manilao facility, room 238.